Uh, Good morning, everyone. I'm presenting a case report, and the title of the case report is "Brain Abscess as Presenting Feature of Melioidosis." A case report. I'm Dr. Saurabh Padel. I'm a DNB microbiology resident at KIMS Hospital, Secunderabad. So, introducing into the matter, melioidosis is an infectious disease caused by Burkholderia pseudomeli. An infection is acquired by inhalation of dust, ingestion of contaminated water, contact with contaminated soil through skin or abrasion wounds. And the main important point is person to person transmission is also possible. So they are considered potential agent for biological warfare and biological terrorism. So case history, we have received 41-year-old gentleman. There is a known case of diabetes mellitus and hypertension since 14 years in our emergency department, and he was having a chief complaint of high grade fever since 10 days and severe right sided headache since 10 days, since 1 day. And in the emergency only, he has one episode of left focal secondary generalized seizure which lasts for 5 minutes. On physical examination, we have seen vitals were stable. There is no significant systemic examination finding with no neurological deficit post seizure. And the patient was shifted to MICU for further investigation and management of the patient. Investigation and reports. Raised counts, CRP, ESR, D dimer all were raised, and the patient was RT-PCR negative for SARS-CoV-2. CT scan of head showed mild thickened pachymeninges along right frontal lobe. An MRI result says epidural collection of 14 into 4 into 5 mm along right frontal convexity with a small subdural collection. And also blood cultures were negative, and CSF and 2D echo were normal. So we started the patient on antibiotics like meropenem and metrogyl, and he has a history of seizure. So we started with anti-epileptic drugs like lamotrigine and topiramate. And for brain lesion, we did navigation guided right temporal craniotomy, and evacuation excision of the lesion was done. And following procedure, aspirate is sent for gram stain, which showed occasional pus cell and no organism. ZN stain says no AFB seen, and 10% QH for fungal stain, it showed no fungal elements. And also tissue culture were negative after 36 to 48 hours. And histopathological examination showed suppurative abscess with ill-defined granuloma. So the finding, what happened after 10 days, patient was febrile and we sent a blood culture. Now 10 days after procedure, paired blood sample for culture and sensitivity was sent, which flagged positive in bacterial 3D system after 2 days, and gram-negative bacilli exhibiting the important feature bipolar or safety pin appearance was seen. And after overnight incubation, rough and corrugated colonies were seen on blood agar meconchiaga. An identification and antimicrobial susceptibility test of the isolate is done by Vitek 2 compact, and isolate found to be Burkholderia pseudomeli. And as soon as we got this organism, we started patient on ceftazidime for 2 weeks. That is come under intensive phase, followed by oral cotramoxazole is given for 12 weeks. That is maintenance phase we have to give. And post above given regimen, patient started improving clinically and radiologically. And after a hospital stay of more than 1 month, patient got discharged in vitally stable condition on oral cotrimoxazole. So by ending the discussion, melioidosis is an infectious disease caused by Burkholderia pseudomeli. It is predominantly a disease of tropical climate. In India, it is reported from South India, such as Tamil Nadu, Kerala, and Karnataka. So clinical spectrum of melioidosis is presented as four spectrum. Like acute localized infection, it can be pulmonary infection, it could be acute bloodstream infection, and could be chronic suppurative infection. First, by acute localized infection, when the bacilli is directly inoculated into the wound or abrasion, such as farmers who are doing work and have direct contact to the soil. Pulmonary infection is similar, and it may range from severe bronchitis to severe pneumonia. And the hallmark of this thing is sputum will be normal in this condition. An acute bloodstream infection, this infection is present in all, it can be present in all those patients who have compromised immune system. In chronic suppurative lesion, this pseudomyeli, Burkholderia pseudomyeli, can involve any viscera, like it can involve brain, liver, lungs, and can form a cyst-like lesions. So chronic suppurative lesion that we have in our